Now we'll go ahead and get started. We are so pleased to welcome Miss Lenora Robinson. I think that her cohort is not feeling well, so we don't get both of them today, but we are so grateful that Miss Lenora has given up some time to share with our guests, our people who are attending today. I'm sorry, y'all, the words aren't coming. She's going to talk to us today about the Family Resource Center and how you can engage with them. I want to make you aware that the webinar is being recorded. Miss Lenora is going to take questions, I would imagine, at the end. So please feel free to drop those in the chat box to see if we can answer those. And we'll go ahead and get started. Thank you again, Miss Lenora, for being here. I have stopped sharing, so you can share or I can share for you. Just let me know. Looks like we've got video. Oh, you're muted. The fun of Zoom.
All right.
Oh, yeah, there we are.
There we are. Good morning, and it is a pleasure to meet with you all. And let me just start by saying I thank Families Up and Families so very much for inviting me. And of course, my cohort is out ill today. It's like Batman without Robin, but we're gonna wing it and make it happen. Families Up and Families, and I had to share this with David yesterday. When you look at Families Helping Families and the FRC collaboration, it is just a beautiful picture. We're kind of like that go to for anyone, any family, anybody throughout the state, whatever the case may be, whatever the need is. And of course, usually when you need one thing, you need a few other things to kind of get stable and get things on track, especially when you have um, a child that is born with a special healthcare need. So I'm thankful that the FRC came to be, and I'm thankful for the Families Helping Families being that individual example throughout the region that people can actually touch, have a conversation with, have that face-to-face interaction, because it is so very important when you're dealing with something you're not really sure of the direction you should go in or need to go in, to have someone to call on. And the beautiful thing about Families Helping Families, I'm not sure to the extent, but most of them have had these personal experiences. Same thing with FRC. So many of us come with lived experiences, and we can actually relate to some of the feelings and some of the complication that comes along with navigating those journeys. And like I said, thank you for having me. And I'm going to get started. We're going to give you a brief overview about the Families Helping Families and the way we do assessments, the way we connect families to resources and outside entities to help them navigate their journey of caring for a child or a family member with special health care needs. Okay. Uh-oh. All right, I'm gonna start with myself, of course. I'm the program manager, and my right hand is Claudia Lawston. And if you're a member of Families Helping Families or other organizations that we work with very closely, you definitely know Claudia by name and face, because she is absolutely awesome in building the relationships with our outside collaborators. And I'm not sure if all of you all know that the Family Resource Center started as a brick and mortar in Children's Hospital, primarily serving those families in the New Orleans and greater New Orleans area, and those children that actually were serviced by Children's Hospital in New Orleans. And we are blessed to have Claire Brown. She was one of those, she and Betsy Snyder were the two that operated that entity as a brick and mortar. So she brings to our Family Resource Center a wealth of wisdom, very good at giving guidelines on what works and what does not work and what families really need as they go out and begin to navigate the process of working with their children. When I came on 3 years ago, and it looks like it was just yesterday, we may have had in each one of our case batch uploads maybe two or three Hispanic families. And I put myself in those shoes, and I found it so devastating that if I'm already going through a crisis, how do I navigate past the language barrier? So when I attempted to hire, well, almost 8 months ago now, my number one request was that I could have someone that could bring that piece that was missing, and that was that bilingual, able to communicate with our Hispanic population, because now we get as many as 15 to 25 in our batch uploads. So that just lets you know how we have evolved and how the population of families dealing with special healthcare needs has grown. And we have Rose Moreno that fills that position. And we now don't have to use the language line as much. In my personal opinion, I appreciate having them, but it's so impersonal. When you're going through a crisis, you want someone you can literally talk to, that human piece, and not have that third party to where you're discussing sometimes very personal information on what you need and why you need it. So I'm so thankful to have Rose on board. And Miss Tiffany Williams, she comes with her own little pluses. She's a social worker. And in addition, she works with our care coordination. And she also came over from the clinic. So having that clinic experience has brought a lot of robust, in-depth understanding to the Family Resource Center and the needs of the families that um, we address and we come face to face with or come in contact with on a regular basis. She is definitely a bridge when it comes to our provider to providers, in clinics and in other settings where providers may want to reach out to the Family Resource Center. And I am happy to say that June 23rd, if all goes well, we will have a new hire on board, that is representative of how much we have grown. And we want to make sure we always have the capacity to address the needs of the families in the state of Louisiana, not just the special healthcare need family, but families that are in need of whatever the case may be that we can help connect them to make life for their family a little more bearable and definitely a little more understanding, because so many times families just don't know, and we want to fill in when they just don't know. Okay, like I said, the Children's Special Healthcare Needs Clinic transitioned from the brick and mortar Children's Hospital. And, COVID didn't do everything bad, because I think this was an idea in the head of the Bureau of Family Health. And I think COVID just kind of was the catalyst to speed it up and make it to come to fruition. So, like, we've been in existence for a little bit better than 3 years, and we are growing, we're thriving, and we are the bridge that connects families to resources and other entities that can help them navigate and become as stable and a thriving family as possible. So I thank God for, not just the gray cloud, but the silver lining, which is truly the Family Resource Center. And like I said, we moved from that brick and mortar. We focused on how can we serve all families, but definitely how can we serve those families that experience so much more disparity than just a child born into a normal birth weight child born into a family, and they navigating just a new birth. We have those that have complications. So how do we better serve them? And believe it or not, this we have grown so much to we have a regional resource guide, which was kind of the brain of the collective FRC, and with us coming with all different experiences, personal as well as professional. The resource guide is constantly growing. We depend on families have been families a lot because you are in different regions and the needs of the families in the various regions sometimes very robustly. So we look to you all to constantly give us resources that are commonly sought after by those families in your regions. This is the way we got started with the resource guide. And I look for this to be an opportunity to continue to grow that regional resource guide so that your families can be served with the utmost quality and efficiency. We're a fully functioning virtual resource center. Of course, our big, probably about 85% of our work is working with Louisiana Birth Defects Monitoring Network and the projects that they undertake. We started with just babies identified with certain uh, birth defects that were under the guidelines of the ones that they were mandated to serve. And we have grown since then. We now have a preemie pilot, and these are children that are born between 22 weeks and 35 weeks gestation. And of course, for those of you that are familiar with preemies, so many times they come into the world little bitty people, and it may not be until down the road that you identify that they really have a special healthcare need. So we are very grateful to have an opportunity to work with these preemies. And of course, this has constantly been a ongoing, growing, and learning situation for us. We're learning so many things that you commonly wouldn't think of. First of all, most people know that when it's a multiple 9 chance out of 10, they are going to be early. How early, it's like a cracker jack box. You never know. But we're also finding that oftentimes we have to really do a deep dive because we have had several multiple births where not only were the children of various weight, but also they may be born on one may be born on one day, the other one or two born the next day. So now you have to be able to input this data so that everybody knows that this is a multiple birth as opposed to just looking at the situation and seeing a child born on one day, a child born on the next day. So it has just been a learning curve all around when it comes to the Family Resource Center and this new project. It has been very interesting, and I hope to continue growing to where we are able to address more disparities when it comes to maternal health and wellness and children born in the state of Louisiana. And this is the Bureau of Family Health. We were given the charge when we first came on as a program to build a collaboration between all of our BFH program families. When I first was given that charge as a program manager, I think my idea was, okay, I just need to let them know that we're here. I need to let them know what we do, and we'll go from there. And it turned out to be so much more than that. We have a ongoing collaboration with each one of the programs, and we have done such a beautiful job of meshing. One big advantage that I find is that they realize what we do, but even more so, we understand what these programs do, what is their design, how they fit into the big picture of maternal and family health. but also these programs have guidelines. And so many times the families that they attempt to address may not necessarily fit into their guidelines for whatever reason. They no longer have to tell them, you don't fit, I'm sorry, we're just going to write you off. They now refer these families to the Family Resource Center, and we're able to provide them with an assessment. And from the assessment, we're able to better understand their needs. And we're able to not only provide them resources, but many times connect them to community programs already set up like the Families Helping Families. And depending on what region you're in, we have other community entities that are there and able to provide them with assistance that otherwise we would know they existed because our program was not able to accommodate them, and they're just left alone trying to figure it out. So I have loved this collaboration. I constantly get referrals and calls from these program managers or people working within the programs. I have this situation. Please advise. And we do likewise. So this is a big reason that we have grown so fast and so robustly as a program because of the support and the collaboration between the BFH family. Okay, who are we? We're the Statewide Virtual Resource Center. We especially address the needs, concerns, and issues that impact children that have been identified through surveillance as having a special healthcare need. And we not only work with the children, but we work with the family. We came on, and part of our collaboration led us to add physical and mental health. We started out with just health as our focus, which is so very broad. And I don't know, the mental health piece during my last 3 years in service has grown just like wildfire. So we were able to actually add physical and mental health to our capabilities, care coordination. Like I said, most times these families come and it's not just one thing they need. They need an abundance of assistance, guidance, and I want to just put it out there. Families Helping Families has been very instrumental in making this happen as a care coordination piece for these families. We're able to really get them connected to programs like Early Steps, where they wouldn't even know which direction to go in. And they understand through Families Helping Families, they can self-refer. If you see something or you identify something in your child that is not on track with that milestone tracking chart, you're able to advocate for your child without any assistance. And it's so much better to have somebody on the ground helping you navigate that. So I appreciate our collaboration with Families Helping Families and other organizations that help them just kind of get started. Sometimes all you need is that little bit of encouragement, that little push to make things happen. And of course, so many of our outside entities help with that education piece, getting them to that learning process. Of course, Early Steps is up to 3. And so many times families have no idea, what do I do after that? So just giving them that extra guidance and that kind of framework of this is the direction we take next. It has been amazing. We actually are working with some families as we speak that have 3.5 and 4-year-olds. They have graduated from Early Steps. They're getting ready to begin school. They now are learning about services that can be provided in school, as well as navigating the IEP and the 504 and the special programs that help these children with their learning process through accommodations. So, like I said, this has been an amazing journey. And, we appreciate opportunities to share with other professionals, other families, other people that are focused on the mission of reducing and possibly someday eliminating the disparities that have Louisiana in such a, I guess, downward position when it comes to success. I think each little bit makes it a little bit better. And everybody contributing and doing something definitely is improving the situation. And of course, last year, right around this time, Medicaid was making changes, and as we speak, we're gonna see some changes. So we had to go in and actually do a little quick learn on navigating that insurance piece and helping these families better understand. You're gonna be assigned a Medicaid provider. You have to make sure that the doctors you have are the doctors that you desire are able to operate under this program. If not, this is what you need to do. We've also learned that so many times these families don't realize that with Medicaid, you have an MCO, you have someone there to help you navigate your medical needs and that medical journey. So just being able to provide this information has just been beneficial to the families that we are accustomed to working with on a daily basis. And about the Resource Center. Our business and our operation, to put it bluntly, we have a uniform way of operating. It has worked, it has been very instrumental in getting the families that we currently work with to thrive. We simply do, we call out to our families through the Louisiana Birth Defects Monitoring. We call them, we give them the information, the demographics. This is who we are. This is the information that we were given through the referral service of through surveillance. We simply do an assessment. Through the assessment, we learn what they have already been engaged in or what they already have lined up. And we kind of fill in those pieces. Well, are you familiar with, and of course, like I said, we start with your regional families helping families. Some have that knowledge and some don't. So we quickly make sure we make it known, the families helping families in their region, and we kind of address them as our on the ground arms and legs and hands that can help you navigate in person, in face to face. And in addition, they serve the whole family. They're constantly doing programs and events that engage the family. So you now are meeting people and building your support system. They may not go through the same diagnosis or disease that you are accustomed to and dealing with, but because they are going through a journey, you are now able to lean on each other and provide that human assistance as you navigate. Of course, once we do our assessment, we're able to actually link them to resources and services, whatever region, through whatever means. I absolutely love Vroom because it's one that they're just kind of taken away. We live in a time where technology and our children are almost inseparable. Vroom is one of these cognitive development programs that they are so grateful to have because so many times they don't know how to engage their children. And let me just put it out there because I had this personal experience. So many times the healthcare professionals don't realize how much you don't know. And the way they say things can be interpreted so wrong from what they intentionally mean. And these parents almost give up hope on, and they just really don't know how to advocate for their children. So as we do our assessment, we're constantly given that a ray of hope. We're constantly saying, and we're giving you these resources. Please feel free that if there's something you don't understand, if you have questions, by all means, reach out to us so that we can better assist you, provide you with a little more comforting, knowledge-based assistance, and being this advocate that your child needs to thrive. So we not only work with the families, we also have a growing relationship with providers. And when I say providers, not just doctors, not just nurses, but if you provide a service to families, you are a provider. You're welcome to call in. And this has really been beneficial when it comes to providers working with that behavior health, be it autism, be it ADHD, whatever the case may be. These providers have learned that we are here, and it has been a beautiful relationship dealing with PPCL. There's a provider line that actually reaches out, and you're going to learn a little more about that as we go on. But I'm just letting you know how the FRC has come together and bridged these programs and resources to better serve families throughout the state of Louisiana. Of course, we use the universal care approach where we're dealing with the whole family, the child. We do this according to national coordination standards that have guidelines and provision already in place for working with families with children with special healthcare needs. We're that low barrier. We're very accessible. We have a universal phone number, and ironically enough, this is the same phone number that was available in the children's hospital. So many times we get calls from children's hospital that these uh, professionals, doctors, nurses that were familiar with the brick and mortar still had that number somewhere. It is still the number that we use. The number comes with the advantage of, if it's not between the hours of 8 and 4:30, leave a message. It emails us to let us know that there's a call waiting and that we need to return that call because there's a family in need or a provider that is trying to service a family in need. So that has worked out great. We have an email address. The email address kind of does the same thing. If you email us, it does not just come to one person. It kind of rolls over to my entire team. So everybody, whoever gets in first or whoever sees this, because so many times myself and one or two others, we may get off at 3:30 or 4 o'clock, but we still go back in and look at emails and phone calls. And we're finding that that has worked out just great because so many times these parents have gone back to work and they're not necessarily able to talk to us during business hours. So we kind of make ourselves accessible to reach out to them, to at least let them know, let's establish a time where we could actually sit down, do an assessment. We can actually identify what is best for your child and your family. So that has been a plus. And of course, we're under the block grant. And speaking of the block grant, uh, our block grant with maternal and family health has been in existence since I don't think it's 1932. So the government ups and downs right now are not impacting us. We're still working with our children and families to get the best quality service to have the best outcomes for these families. Um, and it is a blessing to know that so much is not going to be interrupted and our families are not going to be impacted by whatever whatever direction the country goes in at this point, this grant has been in effect and untouched. It has been modified and improved, if anything. So we're in the process now of writing and doing all the work we need to do to ensure that we continue to grow with this grant and these services that are definitely needed by the families that we provide services to. We utilize our staff expertise. Like I said, so many of my staff comes with a vast array of personal and professional services. We have begun to build a relationship with MCOs. This or similar training that I'm giving to you today, Claudia and I gave to the MCOs across the state of Louisiana about a year and a half ago, and it made for a beautiful relationship because it was just prior to all of the Medicaid changes. So they were able to give us a kind of quick overview of what their program was going to look like. So when the families came to us, we were able to actually empower them with a knowledge base to give them direction on what they needed to do with their Medicaid and how they needed to navigate and actually how to contact the MCOs. So many of them didn't even know that if you turn on the back of the card, your MCO is there. So I'm just remembering when I was going through my own dilemma and I was in that space, it was like I could hear you, but I couldn't hear you. So now that they're kind of grasping the fact that I have a charge to this child to become the very best advocate I can become, I need to be empowered with knowledge and direction and assistance. So they come to us very receptive of the information that we give. So we're constantly building our resources, making our networking connections. I sat on the Lacan meeting about a week and a half ago that was sponsored through Families Helping Families, and I was just amazed. I don't think any of this was available to me 40 years ago, but because I grasped this information and Claudia and Claire already had it, and they're constantly bringing trainings that they've gone through, bringing the information to us so we can better serve these families when they call in or the ones that we actually make calls out to. So definitely that universal care coordination is there. We're doing everything we can to expand it. And I think expanding the care coordination piece is addressing the disparities that have existed for so long that because we didn't have the Family Resource Center, we didn't have entities in the community like we have now, we're able to actually positively impact these dilemmas that have existed forever. And I have pretty much given you this. This is talking about our community level support, like Families Helping Families. And if you're in New Orleans area, there are several. We have We Play Training Ground. Um, they are actually looking to become statewide. So all of these entities that we've able to reach out to in support of our families, they empower us, and we in turn give this information to our families to empower them. It's nothing like becoming an informed advocate for your own child. And that's just the mission that we look at enhancing for a better outcome. Of course, our Families Helping Families, like I said, they come with so many regional specific resources. So we love being able to offer their services to our families because some of the resources that we would generally be a blanket resource, they're able to build on and make it more specific for the area and the families that reside in the area. Um, Families Helping Families also have done a beautiful job of referring some of their participants, for lack of a better word, to us, especially when it comes to Spanish speaking. Now that we have Rose, we've gotten several referrals so that she can assist them in navigating the needed resources for the child and their family, so that they're no longer left out. Okay, this timely linkage, we do occasionally have an opportunity to link families to services that require follow-up. Be it uh, some of the more common ones, let me say that, is the WIC program, the SNAP program. Generally, when it comes to early steps, if we refer them to Families Helping Families, and they get connected. Families Helping Families are very good about assisting them with the early steps program. But those resources and you generally get to know the moms and sometimes dads, when you reach out and make that call, you generally can identify the ones that have that, I'm going to go get it, I need to do this, and those that need that extra little nudge. So they will be on our follow-up list, and they will get that additional phone call after you've given them time to uh, fill out the WIC application or fill out the SNAP application. You can call me back and we can go through it so that I make sure that you've taken all the steps you needed to take to make this happen. So we do have the ability to provide additional follow-up services, and we do so occasionally. And lately, especially these preemie parents, they generally get in, they're very excited about seeing this child grow, because preemies grow so terribly fast. And the things they do are like almost overnight. So they come with a little more enthusiasm, especially once they get discharged and they can actually go home, and that love and nurturing assist them in growing and maturing and meeting milestones. So they're probably the much easier population to deal with, that I find. But we're able to follow up with them. And like I said, we provide them with a follow-up letter to the conversation of all the resources and services that we have recommended through the assessment. And at the bottom of each of these letters is our information. So they have their case manager's information. So if they ever need anything, they're able to call back, they're able to email, um, and and we provide them with our website in LDH, so they're able to go to that, and that has the phone number, the original phone number, where they're able to leave a message, and it emails us. So they have several ways of getting in touch with the Family Resource Center, and that's deliberate, and it has been very effective. And of course, on our part, we talk about financing and the various types of insurance. And this is probably more so relevant when it comes to the provider to provider line, which is the behavioral health. We take all of the family's information, insurance, private, public. If there has been a diagnosis, then we want to know the diagnosis, and of course, the primary care physician or the specialty physician that administered the diagnosis. And what we do, we reach out to the provider services through PPCL. We give them all the information, and they go and they literally go through calling resources, and they call each and every resource in the area that can provide services, and they call them to make sure that this is still a working number. you're still accepting this kind of insurance, or you're still accepting this Medicaid program. And then they send us a summary. We in turn take that summary, we input that summary into our database, and then we reach out to families to let them know this is what you requested, this is your need being fulfilled as you go through it. And we, of course, will walk through it with them. As we go through it, they go through it. We send them a copy of the assessment that was done, and we provide them with whatever assistance they need in getting started. If it's helping them to make that first appointment, whatever the case may be, or we would give them an opportunity to make that first appointment, and then we follow up. But just having PPCL is another one of those really great collaborations that has been so beneficial, especially when it comes to conditions like autism, um, children transitioning, be it grade or transitioning with their IEP accommodations, whatever the case may be. They have been so very beneficial because they will actually do the legwork. They actually put the time in. They come back and we have a little collaboration. And then we're able to provide families with the needed information, resting assured that the information is very valid because it's been checked, fact checked. So this has been a very beneficial program for the families that we're serving in Louisiana. And of course, medical homes. We have several toolkits that are in effect. You're going to learn a little bit more about that as we go along through this process. But these toolkits have guidance already built into them to support the providers in pediatric clinics so that they're able to communicate some of these very, very needed services to their families. And of course, one thing that I've learned, especially if this is a returning family, they have more than one child. This is the pediatrician that's the primary care, or they've gotten very familiar with their specialty doctor or the nurse practitioner. They really depend on them for advice and support. And because we have become this provider to provider service, we're catering to providers. They're our boots on the ground, our hands on. We're getting this information out that will assist them in helping their families navigate through needed services. So this has been a growing part of the FRC that has been a wonderful piece to watch it grow. It has been very, very exciting watching providers come to know about the FRC, reaching out to us for their families. You know, just that little bit of care can take a family a long way. And I'm going to go through a couple of our resources for providers so that you're familiar, because if your family's helping families or other service organizations, you are a provider. So you're able to advocate and assist your families in reaching us if they're not already one of the programs through the Louisiana Birth Defects Monitoring. Like I say, we have the toolkit. We're definitely pushing the development of screening. We provide all of our families that we call out to a copy of the CDC milestone tracking chart so that we are able to empower them and give them the tools needed to advocate for their child. You know, if we tell them all the time, if you're your child's mouthpiece, and if you see something that they should be doing, you're going to probably be the first one to see it. Now you have the ammunition. Take the CDC milestone tracking chart with you to your appointment and let them know, according to this, my child should be doing sitting up, standing up, cruising, whatever it may be. And now you have brought this to the uh, professionals' attention, And they're able, some of them are very familiar with the Family Resource Center. You're welcome to, families are welcome to let them know that I've had a consultation and assessment with the Family Resource Center. They work with providers, and so many times they do bring us in. And once we get to working on this situation together, we have had some awesome outcomes. And of course, the care coordination toolkit, kind of self-explanatory. So many times we would start out with one need. And because of this one need, so many other little gray areas exist. And the care coordination kind of already prepares for that. So you're able to actually put together a group of resources needed by a family to help them navigate as a family, to help them navigate the child's care, to help them advocate just the mental health and stability of the family itself. So we're very, very proud of our care coordination toolkit. Um, it has grown in leaps and bounds. It has almost grown to where it can address so many disparities that exist that we commonly just wouldn't think of off the bat. It kind of has that view and vantage point of what if this exists, then what? So this care coordination has done a very good job of covering the what ifs and whys and how to handle certain situations and what path to take. And of course, the youth transition toolkit. And, you know, when I started experiencing my journey 40 years ago, I had no idea of transitioning from that stay at home child to pre K, kindergarten, and definitely not. Well, we had mastered his situation somewhat by the time he got to high school, so the transition was easy. I'm right now dealing with my oldest grandson who was born off the pulses, and of course he's walking and talking. Thank you, Shriners. But just knowing how to transition that IEP and that 504 plan to the next level. And it's almost the same thing with middle school to high school, and just helping them transition to become the very best individuals they can become. This toolkit is so very helpful. Families helping families is so very helpful. I have learned to reach out to them when I get a dilemma that I'm dealing with. But uh, the toolkits are here, they're available. Um, they are there to help navigate these transitional moments and these moments that actually matter when it comes to navigating a special healthcare need and a family. And of course, let me just put it out there with developmental screening, it's learn the signs and act quickly. The sooner you can identify that there's a developmental delay, the quicker you can get this addressed, the better the outcome. So we're just very proud of the developmental, the care coordination and the transition toolkits, that the extra that it gives to these families that are having to navigate these situations at various times. It has just been an amazing journey. And this is what I was telling you a little bit more about our PPCL, that provider consultation line. It's available to pediatric and prenatal, um, these mothers that have recently delivered or that are pregnant. This consultation line is there for their assistance. Um, and like I said, if you're a provider, and pretty much I'm sure everybody's on this training is a provider in one shape, form, or fashion, whether you're a community entity, you are able to assist your families through the provider line. You take the information, you go online, you put that information in, they're gonna call you and they go over the information that you have provided. So the more information you can obtain initially in your initial assessment of your participant, the better, because you're able to provide them with more and they're able to better understand your need and the need for the family that you are advocating and representing. But this is the provider line. It has been a godsend to us, especially with our um, families that are trying to navigate autism and finding the just numerous resources that are out there. They have been very instrumental, those with the ADHD, and especially when it comes to helping these kids that are in school settings. So it has been a godsend. And family resource center depend on them very, very highly. And we have an ongoing collaboration because we're constantly trying to make this situation better and grow it so that we can serve more families that need the navigation and need the help and need the empowering to be able to advocate for their children. And like I said, the mental health piece is growing. You're able to actually contact them as a provider. There you see the number 833-721-2881 to participate in the provider services. And in the LDH state web, there's also a place for the PPCL. So they're ready accessible to you as a provider. Any mental or behavior health situation and circumstance, they are there to help. And of course, the Family Resource Center, as I stated, we have the same 504-896-1340. This number existed when the Family Resource Center was a brick and mortar in Children's Hospital, and those that are frequent Children's Hospital. So many of them had this number. We get calls from them almost on a daily basis, or people that use the services of the FRC when it was a brick and mortar. It's available from 8 to 4. This is the number that you leave the message and it emails us to alert us that there is someone in need. And that number, at the latest, will be returned that next morning. Some of us come into work like 6:45, myself, and so many times I'm the first one to receive that call. Um, but understand it's going to be handled. And I told you all we've done some growing and transforming on our own. 3 years ago when I started, this is what our card looked like. It helped early childhood education, insurance, and care coordination. And as you see, it has transformed. We have a QR code. We have physical and mental health. The care coordination piece is much more robust. We have all of the toolkits that come under care coordination. The early childhood, we actually do a great job of setting up families to provide them, most times it's families, helping families that carry this off us, that provide them with what to look for when you go in to do an IEP. What should you include in your 504 plan? So we love being able to assist them with getting these kids ready for school. And we have early childhood, but that's early childhood and education, because we have school-based health under our umbrella as a program. We're constantly assisting families with that. As the child grows, the IEP changes, and helping them navigate these changes to better serve their children. And of course, with insurance, the Medicaid constantly changing. We constantly keep in touch with the Medicaid representatives so that they can empower and educate us so we can share this with the families that we constantly engage with. So we want to stay on top of and be abreast of all of the changes as it impacts so that we're able to empower the families that we work with across the state of Louisiana. So if you know something that you feel like we need to know, please don't hesitate and reach out and let us know this exists, especially you entities in North Louisiana. I just hired a new person, and one of my biggest wish list was to get someone in North Louisiana. However, the timing is not there, and that has a lot to do with being able to have them housed in an office location. However, I realized that I have the families helping families that are absolutely amazing. I have the parents as teachers that have been absolutely amazing. But anybody that's on this call, if you know of any resources, any services that you feel like we need to have a part of our regional resource guide, please don't hesitate to reach out to me or anyone in my program. We're constantly trying to grow and be as effective for all families in the state of Louisiana as we can be. And I thank you all. You have my personal email in my right hand, Claudia Lawson. We take emails. We appreciate your input in helping us grow.
Thank you so much, Miss Lenora. A lot of valuable information, ways for different kinds of people to engage with the Family Resource Center, whether it's families through the infant stuff initiatives that you guys are working with or providers. Lots of good things going on. And I love that it's a virtually accessible resource. I don't see any questions in the chat. Please, if you have any, include those. There was one earlier that we kind of addressed as a Families Helping Families office because I think it's relevant. But on the off chance that you have anything to offer, someone had asked if there were other resources or services for a child that's going into the school system and transitioned out of early steps. I know that we do some things in our office to support families. And so, anybody that's got those questions, please reach out to your local office. There's a link. We'll put a link in the chat to those contacts. And then also, I want to remind you again, please include those questions in the chat. We do have the post event survey link in there as well. So make sure that you take care of that so that we can appreciate Miss Lenora, let her know how valuable this was, and so that Families Helping Families can bring other topics of interest to you. Do you
And
have
let,
anything that comes to mind, additional resources for families who have
let,
children?
let me just note, and I want to make it perfectly clear, because we have the Louisiana Birth Defects Monitoring side, and we have the FRC side. We address family needs, not just families with special healthcare needs. And let
Mm-hmm.
me give you a good example of that. In Region 2, the beginning of the school year last year, and everybody's familiar with, we had the COVID money that went on forever. We had the apartment vouchers that went on forever. And all of a sudden, they stopped it.
Mm-hmm.
We had a robust number of families that were homeless in Region 2. They had been evicted because the voucher had stopped. And I was contacted by a teacher, and she was just really trying to advocate. She was in with a school system, and it was a charter school system, so they had several schools within that system, and most of them were experiencing the same thing. She was able to reach out to us, and we were able to actually get with a community partner, and they went and set aside a whole wing for families, moms there, and most of the moms were single moms, of course, for these families to exist. And it was just a beautiful situation. They established a place for them to come live. They also did workforce development training. They also did financial management training to help them get back on their feet and be more efficient as they transition back out into the community. They were able to stay at this facility for 90 days with a one-time extension. And, just that contacting us, allowing us to get in touch with the community partner, and they made these accommodations, and it turned out to be so beneficial. I think we ended up with probably 15 families initially, and we were able to provide services for 10. And let me just say this, I thank God for my staff. They're, like I said, we come from so many different areas and places and experiences. Um, it was pointed out by one of my staff who actually was working in the community at one time. She says, now you're going to be able to help those that really want to be helped. Some of those you're not going to be able to help because they have a different agenda. And I'm in my head saying, oh man, these moms are out there and they don't have. She said, yeah, let me just show you what I mean. Because, we're able to offer the voucher through some of our partners for the hotel, which is short lived. I think it's like 3 to 5 days. And that was really what they were seeking. But we wanted something more permanent because these kids are in school. They don't need to be bounced around from place to place. Well, we had about 4 or 5 families. The moms were actually looking for a place that they could be with no guidance so that they could have their boyfriends come and live with them. So I never would have thought about that. It was way over my head. And one thing that I love about my group, when we come to a problem as a team, we sit and we have a discussion, we work it out. Everybody comes from a different aspect, experience, and our concerns are so totally different when it comes to what we're looking to address. And for some reason, it just seems to work out absolutely amazing on a regular basis. So feel free to understand, and any entity that you're working with, we look for families. We want to support families. So many times it's that food piece, that food supply. We're able to literally identify in almost every region where they can go and find food sources. Um, with young mamas, it's so many times that living accommodation that is the big thing. That and diapers and formula. So we address all families at all levels and understand generally when they have a problem, it's not just a one little thing, it is a multitude of things. So we're happy to be here to provide the assessment and as many resources and community entities as possible.
That's a fantastic resource. It seems like a lot of those things are regionally based, which is hard. But the benefit is that there's the Family Resource Center, there are your Families Helping Families offices that can speak to the regional resources a little better. Ms. Rose in your office mentioned child search. Child search would be definitely, in the situation of the question we had earlier, a valid resource in the individual districts and authorities for like the different school boards and such. That would definitely be a resource. We do have there's a new staff member at one of the offices in North Louisiana that's working on a webinar for homeschooling children with special healthcare needs. That is likely something that we will share if we receive it. Get on mailing lists for your local Families Helping Families offices if that's an interest, or contact me and I can put you in touch with that individual. Ms. Lenora, we had a comment. Great training session, great information, and thank you for presenting. For anyone else that has questions or even needs to direct questions, maybe to our Families Helping Family staff, feel free to stay on or put those in the chat. I know we've gone over by a little bit, but this information has been very valuable. And it's another resource to add to your collection of resources as families and providers. So thank you again for joining us, Miss Lenora. We appreciate you. Please don't forget about our evaluation survey. Again, we'll review that as an office and we'll provide that to Miss Lenora as well so that she has that feedback. We've enjoyed having you today, Miss Lenora. Thank you to our attendees today as well. And we just hope you have a really great day, everyone. Thank you so much.
And I want to thank, while I have them on, I see they're on. I want to thank my team that is on. They are amazing. I don't know what I would do without them. When I tell you I have team amazing, and that's what I actually call them. So understand when you all see these services that are growing and multiplying and reaching out, it's not just me, it's the team.
Always helpful to have great support.